The hook is powerful. So make it interesting. You don't have to say something wild, but you have to say something that you would be interested in to get the person to stop scrolling and continue to look at whatever you're talking about. Earlier on, I would just make, hi, my name is Dr. Mackenzie Kelley, and I'm going to lead you. Already lost them. It's done. It's done. You got to go in right away of like, this is why I choose prepless videos over prepped videos.
AI isn't just changing dentistry, it's completely redefining it. Tune into Bite-Sized Podcast, the Dental AI and Tech Podcast, and stay ahead of the curve.
All right, everybody. Welcome back to another episode of Bite-Sized Podcast, where I've brought on Mac Kelley, Dr. Mac Kelley, Mackenzie Kelley, but she goes by Mac. And she practices in Denver. And I want to start this podcast off by going through my favorite nicknames for Mac. As I go through these nicknames, I want you to pick out one or two that you like the most. And I'd also like for you to, I'd like to know if you ever were called any of these nicknames. Okay. You ready?
Okay. Great.
And then we'll jump into your history and all that kind of stuff. All right. You ready?
Mm-hmm.
Mac Attack.
Yes.
Macaronius. Big Mac. Mac Daddy. Mac Daddy Supreme Sauce. Mac Diddy. Maczilla. Mac and Cheese. Mac the Magnificent. Mac Supreme. Mac Cthulhu. Like Cthulhu. I don't know if you've read the Cthulhu series. Mac Truck. Macaroni Supreme. Mac Flash. Quarter Mac. Mac Crackers. Macaroni. Obvious. Macarito. Big Mac Deluxe. Filet-O Mac. Mac Stack. Lil Mac. Young Mac. Machiavelli. Ooh, that's a dangerous one. Mac 10. Mac Daddy Fresh. Mac Diesel. Biggie Mac. Macarilla Gorilla. Macaroni Tony. Macaroon Balloon. Mac Quack. Macpotamus. That's probably one of my favorites. Mac Magnificent. Dr. Mac. Kind of a gimme. Mac Savage. Mac Fury. Stone Cold Mac.
Ooh.
Macinator. Mac to the Future.
Okay.
Mac Daddy Supreme Sauce. Oh, I already said that one. And Macosaurus Rex.
Love
Macosaurus Rex. All right.
I love them. That's great.
What were you called when you were a kid?
Mac Daddy.
Mac Daddy, obviously.
Of course. Yeah. Mac and Cheese, but Mac Daddy was a big one.
The go-to for sure.
Yes.
Macpotamus never got brought up?
Never got brought up, but I love it. It's great. Damn. I love it. A lot of those never got brought up. I like Machiavelli. That's cool.
Machiavelli, yeah. That puts you a little dangerous. Yeah.
Yeah.
Exactly. All right. So
my sister calls me Macadocious.
Oh, that's a good one.
Macadocious.
Yeah, I might call you Macadocious then.
You're so creative.
I'll send them to you.
Yeah. Okay. I appreciate that.
So, Macadocious. How'd you get started as a dentist? Where'd you go to school? When'd you start?
Great. So yeah, I'm from Indiana. I have always wanted to be a dentist. Go Hoosiers. Yes, you see it. I moved so that you could see this in my background.
Oh, I love it.
I grew up in Fort Wayne, Indiana, and I wanted to be a dentist ever since I can remember, honestly. I'm one of those rare people who picked what you wanted to do back in high school and stuck with it. A bunch of people change majors a lot. I did not. I went into college knowing what I wanted to do. I got the idea from my parents. My parents recognized that I loved to learn. I've always been a huge avid reader, huge into school. They never had to tell me to do my homework. I loved doing homework.
You're kind of a savant a little bit.
Yeah, a little bit of an oddity in that sense. Not saying that you have to be that way in order to pursue dental, but I loved to learn, and I was always pretty chatty and very artistic. I loved making things, and I was
Mhm.
very crafty in the sense of if I saw something like a purse or jewelry in a store, I wouldn't buy it. I would say, "Oh, I can make
Go make
that."
it.
I'll
Yeah.
make it. I would like kind of like take some pictures or like some mental images, and I could figure out how to make my hands do what I wanted them to do.
Yeah.
And
Awesome.
my parents suggested it. They're like, "You should do dentistry. That's kind of like the combination of all those things." And
Mm.
so I was like, "Okay." And so I just started telling people I'm going to be a dentist someday and went to my in-state school, went to IU dental school. It was great. It gave me a great education. A lot of people will, say good or bad things about their dental school, but I really think it is what you make it, and I sought out the resources of the people that I wanted to be like and learned from them. And I actually used to want to do oral surgery. I had a really great mentor in high school and through dental school who was an oral surgeon. He's since retired, and he really believed in me, and he was just like, why don't you try to do this? Like, you can do anything you want to do.
Mhm.
Dr. Mike Stronzak, I'm going to give him a shout out. He was like one of my first people who like really believed in me other than
Believed
my
in you. Yeah.
parents. And so I went into dental school saying, I'm going to be a surgeon. And a lot of my faculty members, I think, recognized that I was pretty artistic and good with my hands, and it came naturally to me. Other dentists might hate me for saying that, but I lab work was easy for me, and I
Mm.
liked doing it. And a lot of my faculty came up to me and they're like, we heard you want to be a surgeon, but you should really stick to general dentistry. You'd be a great cosmetic dentist
Cosmetic.
because
Yeah.
not everyone has the hand skills like you have. You should
Mm.
actually pursue this instead. And so I'm so grateful that I took their advice
Yeah.
and pursued general dentistry and really kind of just went down the path of cosmetic dentistry specifically because I do love it. I am good at it. It feels natural to me, like it's such a good fit.
Yeah. The reason I wanted to have you come on the podcast is because um, there's with the changes in the search algorithms, right?
Mhm.
Like how a practice is being found online. Social media is so important
Yeah,
nowadays, far more than it used to be in terms of being found and being recommended by like AI search. And you have done a phenomenal job of figuring out how to create great social media content. So the whole the whole goal here was to kind of dig into your methodology and the tone of how you create social media content to hopefully give the audience some direction on how to do this appropriately, how to really
sure.
approach social media. So my first question, and I appreciate you giving us a background on how you got started in dentistry. That's cool. Um, so my first question is this: you told me that when a new patient comes in, you walk them into your office or an office, and you
Mhm.
sit down with them, and you have like a one-on-one consult, right?
Mhm.
Now I've been to the dentist. I've been to several dentists over my life. I've never had a doctor walk in, sit down, and say, "What is it that you're trying to accomplish?" I always take me to the operatory chair. They drop me in the operatory chair, and they just start working, right? So
Sure.
the that one-on-one touch is, and I'm sure a lot of doctors do it. I don't know. It's never happened to me, but I wanted to ask you what the philosophy is here. What are you trying to create? And then I want to align that with the way that you create social media content in terms of your philosophy. So can you tell me a
Sure.
little bit about that process?
Well, I do want to be different. I do like what you just said, that no one's ever done that, or maybe it's just not happened to you.
Yeah,
That's my goal. I want to do something that's memorable, that sticks
right.
in the patient's brain, and they're like, "Wow, no doctor has ever spent that much time with me before."
Mhm.
And I honestly forget the origin of where that came from, that idea.
Right.
Um, we haven't always done it that way in my practice. Like, sometimes my assistants or my hygienist did the interview, but things really changed when me and I practiced with a couple other doctors. We got the idea, hey, we should actually sit down with the patients for 10 minutes first and get to know them and
Mm-hmm.
figure out what they want and develop that first initial trust so that before we start shoving x-ray sensors in their mouth. I mean, I think that that's really powerful because I am wanting to do cosmetic and more high-end dentistry. I
Right.
think it's really important. There has to be that element of connection and trust before you start putting objects in a patient's mouth. I think it's really important. And the dental office is such a vulnerable place. It is, our smiles mean a lot to us. It is our face. Even if you don't work forward facing and with patients, your face is everything. And it is why you feel confident going out with your friends to dinner and why you feel confident in job interviews. So I really sat long and hard and thought about, what is it that we want to create here? And I think that meeting a patient like that first before you ever do any sort of exam is really powerful. And then all of a sudden, dentists will joke around that patients decline x-rays all the time. My patients don't really decline x-rays because I've developed the relationship of trust from the get-go and explaining like, hey, I need to do a couple elements of this. This is what's going to happen. This is what you can expect in this appointment. And then they're so much more willing to let you do what you need to do to do your exam.
Well, that trustworthiness probably significantly increases case acceptance, I would imagine,
Absolutely.
especially on big cases, right?
Absolutely.
Nobody's going to write a check for $20,000 if they haven't felt like they have a personal connection.
Yeah.
So,
oh, sorry, go ahead.
No. You say what you're going to say, and then I had a follow-up question.
Yeah, some of my big smile design cases where they're $20, $30, $40,000, they tell me, and sometimes I'm only talking to them for 10 minutes right at the beginning, and they're like, wow, this is my third consultation. The last person told me I need $80,000 worth of work, and I didn't even get to meet the doctor. It was the assistant or the hygienist telling me. And I'm just like, how can you do that? Remember, like, the buyer experience. When you buy a car or a house, I am not putting down money until I see it and I know where my money is going. Like, you got to build some value.
Yeah. So that level of trustworthiness that you're building in your consultation process, it seems to me that there's a connection in terms of the way that you present yourself to the patient in the office to how you're presenting yourself online.
Sure.
I think there's a connection.
Oh, yes.
It seems like there is. So can you talk, do you see that?
Absolutely. And I think you're going to go into this question of like how I present, like, do I let the patients into my life in terms of showing
that's
everything?
for sure.
Yes, I do. Some dentists and doctors don't believe in that. They only show the before and afters or the consultations, or it's very professional. And that's someone else's approach, and that's fine, but it's really not mine. I love the patient getting to know me and them recognizing that I'm a human too. I have fears and I have insecurities and I'm goofy and I'm silly and this is how I talk. So a lot of times when they come in for that initial point of contact, they know me better than I know them. They've already like committed in their mind to treatment because they've followed me for a year or two online and they already know what kind of human I am.
Do you actually see that though? Do you actually have patients say, I've been following you?
Oh yeah.
Online?
All the time.
And that's what really?
All the time.
That's awesome.
Yep.
That's awesome.
I've been following you for a year. I'm so excited to be here. And they'll just be sitting there almost like in awe. And it's interesting because I don't know them at all. And they're like sitting there and like, oh yeah, I saw that. Yeah, I already know what bonding is. I already know what veneers is. I saw your last Instagram post. They already come in kind of knowing what they want and knowing who I am. And so that element of trust is already there. And in a way, they've already kind of bought into me. It's just, I just got to get to know them a little bit better and make sure that they're a good candidate for whatever they're wanting.
So in your online content creation, right, or your online marketing efforts, right?
Mm-hmm.
Are you doing anything other than social media? Are you doing search engine optimization? Are you running ads? Are you doing anything like that? Or is it mostly just social media content?
It's mostly social media content. I
Okay.
have hired a website designer, and my
Mhm.
website is not live yet, but it is in the works of being um, made, and that will go live. And I think she is going to go into like SEO and search engine optimization. But all of my patients so far have found me on social media, or word of mouth, of course.
Yeah.
But yeah, most of it's just social media.
So when you were deciding to start, marketing, why did you land on social media? Is it just the right venue for kind of your personality, or did somebody say you really need to do social media, or why did you land there?
I already had an Instagram account,
Mhm.
and I was already making some content, but not really as much as I do now. Like I would post a picture of my dinner or like post a picture of my
Yeah.
vacation. It wasn't really being used for my before and afters or anything like that.
Yeah.
But I started to recognize, and I started to have this epiphany that I my eyebrows are microbladed. How did I find my person? I found her online.
Yeah.
And
Yeah.
I get my hair cut. I have curly hair. Not everyone knows how to cut curly hair. How did I find my person? I found them online. And so why shouldn't we find our dental professionals too in that same way if we're wanting something specific,
So
So
when you say online, you're specifically saying I found them on social media.
social media, social
Okay.
media.
All right.
Yes. I should
Okay.
clarify. I'm sorry. But yes, I recognize that a lot of clients or the clients that I'm going after or I'm wanting because that's the work I enjoy doing. I love doing smile design, smile creation, the artistic stuff. That is something very specific. So how do I go after those specific clients? A lot of those clients they're humans just like us. They scroll on their phone.
Yeah.
I don't
Yeah.
know many people who don't. And it's I just was like, "Oh my gosh, you know what? I feel embarrassed too." Like, you mentioned like I'm an extrovert, but it is a little unnatural even for me to post. You really have to kind of let your guard down
Right.
and be humble. And a lot of dentists are afraid of sharing their work because they're afraid that other dentists are going to criticize their before and
Mhm.
afters. So that's why a lot of them don't do it. And I started to think about, am I posting for patients or am I posting for dentists? If I'm
Right.
going to like educate and my platform is to train other dentists, then I can go down that route. But my
Right.
cases don't have to be absolutely perfect because my patients, as long as there's an improvement, the patients are happy. I don't need to go
Yeah.
down this
Yeah.
whole rabbit hole of pleasing everybody.
Yeah. Yeah. So when you started using social media as kind of your main marketing platform,
Mhm.
what was the what was the process of creating content? And I'm asking this question because, we've worked with thousands and thousands of dentists across the United States with social media, trying to encourage them to get involved, but also like, what do you create? And the number one problem that we run into is just trying to get them to take the photo, right? Or to
Okay.
shoot the video. I mean, the mind space of just having that moment where you actually do the activity to get the content is the most difficult part. So when you started doing this, were you shooting all the content yourself?
Yes, I was. It was a one woman operation. I was shooting it all myself. I was editing it all myself. I mean, it takes a lot of work.
How
And
how much time were you putting into it? I'm curious.
oh gosh, I mean, probably at least an hour or 2 a day, like a lot of time,
Wow. Okay.
a lot
Yeah.
of time.
Okay.
And
Yeah.
maybe that wasn't every single day. It would be maybe sporadic, but a cool case would come in and I'd be like, "Oh my gosh, let's get this." And I would ask the patient like, "Hey, is it okay if I film this? I'm not gonna get to your
Yeah.
face. I just want this. Is that okay?" Like I'm gonna educate people or I'm using
Yeah.
it
Yeah.
for my social media platform. And then you have to spend time editing. But yeah, it does require a mindset shift
Sure.
because a lot of people that I talk to, they want to get off their phones and use their phones less. So that's another concern, is they're like, I don't want to be on my phone more. And I think dentists need to start thinking of being on social media as work. Like when I'm on my phone, I'm clocking in. I'm not an hourly employee, but that's how I try to train my brain to think about it. I am clocking in. I have a job to do. This is not my time to sit there and doom scroll. I want to look for other dentists and look what content that they're putting out and look how many views do they have. Oh, that reel did really, really well for
Really
them.
well. Yeah.
I'm going to recreate something like that. And so then I'll kind of have these ideas in my head. And it is a little bit, maybe I'm not the poster child for having great systems. It is, to be honest with you, my content creation is getting better, but it was at the beginning a lot, very sporadic. I would find something cool, I'd film it, and then I would sit there and edit it, or I would have days, my days off. I would sit there and film myself for hours and then edit it all. And then I would almost like batch create things. I would have like 3 reels that I'm going to put out for this week or for next week.
That is, that's the part that nobody wants to do. You know, a lot of doctors call us a lot and they say, I know I need to do social media. Do it for me.
Yeah.
Right. And we're like, well, that's not going to work that well.
Yeah.
You have to kind of be involved, and they're just like, I just don't have the time for it. I mean, you're obviously a creative person. Okay. So you have a creative, aspect to your personality and who you are. And so you might find that enjoyable or kind of entertaining doing those tasks. But a lot of people, I'd say most people, to become creative is not something that they don't know. They don't know how to do it. And it's like me trying to fix the mechanical issues on my house. Like I'm like, just hire somebody to do it for me. I don't want to do it myself because I'll just start cursing.
Sure.
So for you, it kind of is something that is interesting and it's fun. It's definitely a task, right? I mean, it takes time and energy, but you've been willing to like put that time and energy into it. So I guess my question then is, how do you like, let's say you're a doctor and you're not like that. You're not creative.
Sure.
Like, how do you solve the problem? I mean, you just simply have to be on social media if you want to be found nowadays. It's an imperative. People don't realize that, but it really is. So what do you do with a doctor who's like, I can't sit down for 2 hours and edit videos? Like, what do you tell them?
So I do think it's a skill like anything else. If you wanted to learn implants, you would take a course. You might take a weekend course and you would put in some time to learn how to do it. And your first implant you place is going to be very slow and it's going to be frustrating. And there's going to be some things like, I wish I would have known that before. And so there is definitely a learning curve to it. And I would argue with the person who says they don't have time, because I would say, well, let me check your screen time. How much time are you spending on your phone? Oh, you spend a couple hours already? You did have time. We all are busy. It's just managing your time and thinking about the time that you're on your phone a little differently. And if you aren't creative, utilize the resources that are already there, and what I mean by that is I recycle things. I find creative dentists out there and I'm like, wow, that's an awesome idea. And I bet you if I did a deep dive, they stole that idea from someone else too.
Somebody else. I mean, it's all been done. It's all been done. It's all been done.
And when dentists reach out to me and or I'm with them in a class, they're like, oh, I love your social media. I'll say, copy my stuff. Copy it. I'm giving you permission. Go ahead. I don't care. Like literally do the exact same thing and see how it does. And maybe you're funnier than I am, or maybe you're more educational than I am. I don't care. And so I think, it's different than taking a screenshot of my before and after images. That's totally different. But
you shouldn't do that.
You shouldn't do that. But all of us recycle images. Really no idea is totally unique. And so I started to look and research and clock in and get on my phone, and instead of just doom scrolling and shopping, I would look to see what dentists are doing well on social media. What
Yeah.
ideas have they done? And I will do this. And then, now the content creation is not the hard part. Now the editing is the
Is the
harder
hard
part,
part.
and the time it takes to do that. So now you can outsource that. There are tons of companies and people who are willing to make content creation. And like you said, I bet you would take on a doctor if they say, "Hey, here's a couple hours worth
Oh,
of."
if they gave us, yeah,
Wait,
absolutely.
what? I mean,
That's what needs to happen. The content
yes,
needs to be captured in the office, and then you hand it off to somebody else.
yes,
By the way, we call this idea of like copying people.
mhm.
Okay, we call it copy genius.
Okay,
Find somebody online that's a genius at whatever they're doing, and just kind of copy what they're doing. And there's nothing wrong with that because, frankly, it's already being done. So, really, it comes down to just getting the content. It doesn't
yes,
really necessarily matter whether it's been done before. It's like
yeah,
the doctors that are out there that are actually creating the content get the eyeballs. That's
yeah,
just that simple. So
and
you
and
you
I
end up
think
go ahead. Go ahead.
And I think too, like, yes, you are spending a lot of time, right? And sometimes you'll question, why am I doing this? Does anyone even watch this? Do I feel idiotic? And what's the point? And then patients start coming in. And then they
Then you're like,
start
oh,
oh, and then you start nailing cases that are X, Y, and Z dollar value. And then you're like, okay, all of those unpaid hours mattered. It did
yeah,
something for me. Like, the first
right,
time I landed a case that was $40,000 and she found me on Instagram, all of a sudden, all of those months of me making content made it all worth it because now I'm getting
yeah,
patients that way. Now
yeah.
I finally got paid from all of those unpaid hours. So I really think dentists need to think about it differently and change their mindset.
Yeah. You mentioned that you can outsource the editing portion. I know that you told me that you've got somebody that you work with.
Yes.
Can you tell me like who that person is and how you set up the relationship with them and what their job is versus your job? Can you just break that down?
Well, I've gone through a couple people of like helping me edit. Sometimes my husband helps me edit, like shout out to him. But right now, I actually use one of my dental assistants, and it's like her little
Mhm,
side hustle because she's always there in the office with me. So I think for a
mhm.
dentist, that's your number one untapped resource are your dental assistants. A lot of them, so at least in my office, they're younger than I am. They're a lot more tech savvy. They know what the
Right,
social trends are, and they can film you, and they can film what you're doing. And right now we kind of have this relationship where I say, "Hey, for every reel you make me, I will pay you this dollar value." And then I put a little incentive towards it of like, "Hey, if it gets X amount of views, then I'll give you a little bonus on top of that."
okay,
And so then it becomes like fun and creative for her because she is challenged to make me get more views because she has a
right,
financial incentive to do so.
right, right, and you've also incentivized it both ways, one for the effort and secondarily for the quality of the content.
Sure.
Quality being measured by the number of views or engagement or however you measure that.
Yeah.
So what's your cadence now? I mean, are you trying to do like one video a week, two? I mean, is there, or you just kind of play it by ear?
I
How do
made
you?
it a goal to post something hard post every 3 days. I want to be a reel or a hard, like a before and after photo. I really try hard to post something on my story every single day, even if it's
Okay.
what I'm doing. If here I am running errands, I'm at Target. It's not even dental related, but I
Yeah.
just want people to continue to see my face and once again recognize that I'm a human like they are. And so that stuff's easy, just film what you're doing and let them into your life. I think that that's why my patients trust me because they see me. They see my
Okay.
face.
Let's take a doctor who's an introvert. Okay. A
Sure.
lot of doctors are introverted,
Yes.
and they are not going to do that. They're
Yeah.
just not going to let their online presence in, they're not going to produce content that's going to, let
Let
people into
people
their
into their
personal lives.
life.
They're very private. Okay.
Yeah.
So, but you have to create that type of that's the type of content, the content that is personalized. It does kind of like create some transparency into your personality and who you are, is almost necessary in order to get the awareness and the views, because that's what people are looking for. So
Yeah.
what do you do in a situation like that? You have an introverted doctor who's not going to create the content that we're talking about.
Sure.
What do you tell them?
I tell them, I think a lot of times they're afraid to talk, right? Like that's that's the most intimidating thing,
Right.
is to talk on film. So I think one of the easiest things they can do to kind of get into it and start making some content is to film themselves or somebody else doing something and then just have words over top of it. Like, so my
Okay.
example is I'm brushing my teeth. I'm not saying anything.
Anything.
Anything. And over top of it, I'll say something like, these are my top 5 favorite toothpastes. Like, that's
Got
it.
it.
Literally. Or I could have a voiceover. And so then I can record it as many times as I want to. Hey, this is my top favorite 5 toothpaste, and this is why.
Right.
But if they don't want to do that, have your assistant say it in their voice. But I think it is powerful if you can show your face, even if you're not talking. So I think that that's an easy way to kind of do something. You could even show one of your before and afters and do a voiceover and say, this is what I did in this case. I did Invisalign on the patient first because their teeth were not in the right position. And then I did 4 veneers afterwards. That's it. Like they can keep it really simple.
That's actually a really good idea. The idea of someone, so I could see content being created like this, where a doctor's working on a patient, or just, kind of like B-roll around the office.
Yes.
Right? You're just filming the doctor doing things around the office, but you have an assistant or somebody in your team doing the voiceover. So it says, Dr. So-and-so did this with blah, 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 blah. And so the doctor doesn't have to do anything other than just work.
Yeah.
And it doesn't necessarily really break through on that whole transparency thing, but it does introduce the doctor to the audience without the doctor having to look at the camera and speak.
Yeah.
Where you've got somebody kind of narrating it. So you get a narrator basically.
Yes.
I think that's a great idea.
I think that's helpful. And then when I talk to dentists in the community and tell them that idea, they're like, oh, wow, that's awesome. I'm like, yeah, I'm not asking you to do a coordinated dance with your dental assistants. No, you don't have to do that. Even I'm embarrassed to do things like that, and you don't have to show your before and after cases because that's really intimidating to show your own work. Instead, why don't you have your dental assistant film you walking down the hall? You could literally be walking. You could have them film, here's a tour of our office. This is what you can expect when you come to see us. Like, and just someone's holding the camera and walking in, and you're just kind of walking through.
Yeah.
And someone's doing a voiceover. I think that that's low-hanging fruit. That's really easy to kind of start social media creation. And then I think once that dentist starts to see that they're getting likes and they're getting good feedback, they're like, oh, maybe this isn't so bad. They're getting positive reinforcement that they aren't as goofy as it feels. It's not as awkward as it feels. And then I think once they start to get positive reinforcement, it encourages them to do more.
And what about doctors who, okay, let's say it's an introverted doctor. They don't want to be on camera, but they don't want to be goofy, or goofy is not the right word, but they want to be really clinically kind of uptight a little bit. Right.
Sure.
So a lot of the stuff that works well to build trustworthiness online is not like buttoned up clinical kinds of stuff. Right.
Sure.
So when you're dealing with, so what I've told doctors in the past is I said, look, if you're really uncomfortable on camera, then you've probably got somebody in your team that's an extrovert that would love to do this kind of stuff. Right.
Yeah.
And why don't you hand off the project and the content creation to this person? Which is kind of like what we're talking about, getting somebody to narrate stuff and whatnot. But how do you handle a situation where a doctor doesn't even want to do, like, I don't know. It's just like, sometimes when we give doctors ideas, they're like, that's the stupidest freaking idea. And the thing is the idea we've given them is like a trending idea that like
Yes.
would blow up, right?
It
It
would
would just
blow
blow
up.
up online. Yeah. And I was like, I'm not doing that. I'm not doing that. So how do you like create a tone for a doctor who's kind of introverted, doesn't want to appear, um, you know, kind of comedic
Vulnerable.
or just
Yeah.
vulnerable. Yeah, it doesn't want to appear vulnerable. Like, what do you do with somebody like that?
I
Because
think
because let me say one more thing. You can't. So when you promote a dental practice online on social media, you have to focus on the doctor. You
yes.
can't just focus on the practice. I mean, it is good to like introduce the practice to the community, but really what people want is they want to know the personal, there's a relationship that can be established with an individual. And that relationship really needs to be established with the doctor.
Sure.
So how do you handle that when you have a doctor that's buttoned up, is introverted, and like not willing to try like fun, kind of interesting stuff? You know what I mean?
Yeah, that's hard. I don't
It's
know. I
it's
don't
it's
know if
really hard.
it's really hard. I think that the, narration thing would be very helpful, and there's no problem with maintaining a professional tone and sitting there and being in a white coat or being in your lab jacket or whatnot and being in your office and having someone ask you some questions. And they can be really respectful, professional questions about, hey, who's a good candidate for clear aligners? And you just say your answer. I would even say, how do you create ideas of like what to talk about? Why don't you ask your front team, what are the most common questions that patients ask on the phone?
Yeah. And just
Why do
answer questions.
Yes, answer questions. You don't have to, and have your dental assistant or someone from on your team interview you and then have someone edit it out. And that is a little intimidating, right? Because once again, that's your face. But, you know, if you're wanting to do social media, you have to
Oh,
try.
the idea that I just thought about as you're going through this is like, that show Mythbusters,
Yes.
where they come up with some myth and then they prove it wrong, right?
Yeah.
Um, that could become a theme. Like this is just one idea, okay? It's not goofy. It's not like social media dance video-esque, but
Yeah.
there could be a video every week where the doctor busts a myth,
Yeah.
right? It could be Mythbuster Monday, something like
Yeah.
that, right? And
Tip
so you just come
Tuesday,
up with some sorry?
like a Tip Tuesday,
A
Mythbuster
Tip
Monday.
Tuesday, yeah.
Yeah.
Mythbuster Monday, Tip Tuesday, and it's really just, and this could still be narrated. It could still
Yes.
be narrated if the doctor is not even willing to answer the question on camera. But you come up with a theme. If you can come up with a theme where that you're kind of like piggyback on the theme, then you can create a cadence that makes sense, right? Rather than
Sure.
trying to think every week, what am I supposed to do?
Yeah.
So there's always going to be a way that you can deal with that introverted kind of like heavy clinical type of a
Yeah.
doctor who doesn't, you're right. There's something there that could work.
Yeah. Yeah. I
Yeah.
agree. It's just like you just have to find what feels great and what feels authentic. I do think, even if the doctor's not going to talk, it's nice the patients want to know what they look like,
Yeah.
not because that's what they're choosing on, but it's like you're a human. You need to show that what you look like so that there's some familiarity like
Yeah.
already
Yeah. Yeah. Yeah.
present. So, even if you're not talking, it can be like a voiceover, a narration, and the doctor is doing something and someone else is narrating. Or it's, the doctor's voice narrating,
Mhm.
but it's not their face or something. But like there
Right.
has to be some sort of compromise. But I really think that the patient wants to get to know the clinician. I think that's
Yeah.
important.
Absolutely.
Mhm.
Absolutely. Yeah. Yeah. I'm thinking of my last dental experience. I went in, I had built a relationship with this previous doctor. He was super cool, and he was gone when I came in, and I didn't know. and another doctor walked in. I didn't know who he was, and he was very like
It's a
pointed.
stranger.
He
Yeah.
was a stranger. I didn't know anything about him. I wanted to talk to him, but he wasn't. He was moving through the operatories, and it was kind of like a manufacturing line kind of thing.
Sure.
It felt like
Yeah.
it was a little bit distasteful. All right, so if you were to start again, let's say that you move back a few years, you haven't started on social media, knowing what you know now, what would you do now? Like if you were to get started today, how would you set up your social media content creation process as like the best place to start? What would you do?
Yeah. I would recognize and know that consistency matters more than like the, A plus quality editing. It's more important.
Yeah.
It doesn't have to be perfect. It has to be done. So whatever you
Okay.
have to do to post more often, whatever, and
Yeah.
then, make it easy for yourself, whatever it is. Maybe that means on Tuesdays, you're doing batch social media creation and you're going to make some content for the rest of the 2 weeks or for the rest of the week. And on Instagram, you can pre-schedule your posts. So you can
Yeah.
take all of it and then schedule that one's going to post on Wednesday, it's going to post on Friday, and then it's going to post on Sunday. So early on, I wouldn't post something until it was absolutely perfect. I have learned that strategy doesn't work and you should
Right.
just post more often. I'm not saying crappy quality content, but just post something,
Yeah.
And so I would
Yeah.
recognize and I would just start putting it out there no matter what it is.
Yeah.
I also would pay. I think I started out early on with before and after photos, and I have recognized that videos work better and
Whole lot better.
so much
Whole lot
better.
better.
Reels or something. It's all about Instagram and TikTok is rewarding the amount of time that the patient or the client is looking at the content. So they're going to look at a video longer than they're going to look at a photo. And so same thing with carousels. Like if you post several photos, like a batch of photos, kind of like showing like the steps of the process, the person is going to sit there and flip through the
Scroll.
photos. They're going to scroll through that little bundle of photos. So that works a lot better. Early on, a couple years ago, I just posted one before and after. And I thought that was the most important thing to do. I don't think that that's the most important thing to do anymore. It's all about screen time. So it's like hook the patient, make it interesting right off the bat. And, they need to think about when you're scrolling, you're going to look at a reel for 3 seconds. If it's not interesting, you're skipping it.
You move on. Yeah.
Yeah. So you have to master the hook.
The hook. I was just about to say the hook. The hook is really important.
The hook is powerful. So make it interesting. You don't have to say something wild, but you have to say something that you would be interested in to get the person to stop scrolling and continue to look at whatever you're talking about. So earlier on, I would just hi, my name is Dr. Mackenzie Kelley, and I'm going to lead you. Already lost them. It's done. It's done. You got to go in right away of like, this is why I choose prepless veneers over prepped veneers. Oh, within a couple seconds, you have to tell them what they're getting.
Why they're
why they should stop and listen to the video. So I think a lot of
going back to that Mythbuster idea, a good hook is like, I had a patient come in and tell me that they would not use fluoride.
Mm-hmm.
Here's what I told them, something that's like, oh, okay, maybe I want to listen to this. It has to be, you don't want to introduce yourself on every one of your posts.
No,
they're
you
already
don't.
seeing your channel. You just want to jump right in for sure.
And with regard to that fluoride hook example, you could even make it shorter. And I think you should make it shorter of like, fluoride is bad for you. What? Like that will be like, and then they're like, actually, just kidding. This is what, you know what I mean? Like, I'm not saying like lie right off the bat, but you have to make it interesting right away. Otherwise, they're scrolling.
I love it. Macadocious.
Yeah.
I'm going to put your Instagram link, and you have a YouTube channel, I would imagine. I've looked at your Instagram. I haven't looked at your YouTube. I'm going to put all of your links in the description here. So anybody that wants to copy Genius, just go copy Mac.
Sure.
And when you get your website finished, you need to give me your URL so I can drop it in the description as well.
Sure. Yeah.
But
Thank you.
you're doing a phenomenal job on social media, better than most.
Thank you.
But better than almost all.
Not perfect, but getting better every day.
Yeah. And it's just your insight is super, super helpful. So I really appreciate you coming on. And let's. I really appreciate it, and I might bring you back on again, and we can talk about another topic related to social media.
I'd love to. Yeah, let me know.
Okay, cool. Well, thanks for coming on. I appreciate it.
Thanks for listening to Bite Size Podcast. Tune in to stay up to date with everything dental AI and tech